We are back once again with Karin Carroll from Gloucester's Board of Health. There is a ton of info to relay in regards to the latest in the COVID-19 update. How are you, Karin?
I'm good, thank you, Corey. It's great to be back. Good
Thanks
to see
for being
you guys.
with us. Heather, is your seatbelt on?
Yeah, I'm ready. Karin,
okay.
just talk to us.
All right, Karin,
Tell
take
us
it
what's
away.
going on.
Yeah.
All right, let's just spell it all right out.
Yeah.
So lots has happened in the last few months, and I'm going to start with the picture of where we're at with COVID right now in our community. We have in Massachusetts less than a 1% positivity rate, so very low percentage of people actually testing positive, which is great. We've seen a significant decline in hospitalizations. We currently have 0 patients in our hospital here in Gloucester, patients hospitalized for COVID. And we've seen a decline in the new number of cases each day. So for example, in Massachusetts, there are only 188 as of yesterday for the entire state, and there's only 4 in Gloucester as of yesterday. So there are virtually no cases or contacts in our schools. The schools are still fully functioning, they've opened up full time. They provide on-site antigen testing for students or symptomatic students or teachers if needed. We still have our BioBot wastewater testing going on community-wide, and those levels of detection continue to come way down to a very low level. And at this point, there's not the level of detection, there's no detection for the variants of concern. So a couple of months ago, we did have detection of one of the variants of concern here in Gloucester. So we're really pleased with that whole picture. We're also moving into summer, as we saw last year, as people are outside. There is less transmission of any kind of a virus, colds, flu, any of that. So we've got all these good things working in our favor. And the other thing that's really important is that we have very high vaccination rates. So between the low level of virus and the very high percentage of people vaccinated, there's really not much space for this virus to jump to. So that factor alone is just, the two of those things together is so important in our level of comfort and safety around the new changes that we're going to talk about in a minute, and people getting back to more normal pre-COVID activity. So in Massachusetts, currently anyone over the age of 12 is eligible to get the vaccine, and there's different types of vaccines. And there's plenty of vaccine in Massachusetts. We have the mass vac sites still, we have walk-in clinics available in most communities, CVS sites here in our area. And we're also partnering with our Gloucester Family Health Center. So the health department still has a vaccine program that we hope to continue, that's doing a lot of education and outreach, and then a lot of targeted vaccine clinics. So our hope is that we can have an ongoing way to deliver vaccine here on Cape Ann and the North Shore area that is just going to be available ongoing as people's readiness, as they decide that they'd like to get the vaccine or they have time. We're also trying to remove all those barriers for getting the vaccine. And one of the biggies is time and transportation. So we're excited that we're at the point where vaccine is coming back locally to be more available to lots of different local entities, so people have lots of choice and it's very convenient. We've been, as I said, offering clinics in conjunction with the Gloucester Family Health Center all spring, and we'll continue to do so as there is demand. We have seen a significant drop-off in demand, as most communities have. But again, Massachusetts and New England in general is sitting very high, over 70% or around 70% for all of those New England states. So we're in a really good place in this part of the world. So we've done some clinics recently. We're starting to trial some more mobile stuff in partnership with the Curative down in Danvers. They came up to our schools yesterday, Monday. They'll be doing first and second doses of Pfizer for any parents that opted to have their kids get the vaccine. And that's a huge win for the schools to be able to offer it on site and for parents. Kids need this for jobs, for camps, if they're going to college. So we think it's really important, and we were thrilled that Curative was ready and willing to partner with us to do that. We've done some small partnerships with the Coast Guard, did a training last week, and we provided vaccines at the Harbor Masters new facility for anyone doing the training and had some takers. These are the kinds of initiatives, very targeted outreach to certain businesses, communities, neighborhoods that were either hardest hit or that want to just make sure have the opportunity to get the vaccine. So we'll continue with that work. Again, the percentage of the total population, so this is all ages, including kids, vaccinated for the state of Massachusetts as of last Thursday, so it's a little bit old, this data, was 61%. Here in Gloucester, we are at 67%. So that's great. We have a very high vaccination rate locally, and our numbers, our percentage of folks vaccinated who are over 65 is close to 90% in both of those age categories. So this is fantastic. This is the group that was hardest hit, that we worry the most about. But you know, other ages can and are affected. Some of our hospitalizations statewide are getting younger now. So that's concerning, but again, the numbers are so much less in terms of the total number of hospitalizations. So the other things we're watching for really closely statewide and then here locally is vaccine inequities. And you may have heard a lot of talk about this from Governor Baker's office, from the Department of Public Health, worldwide. It's a real issue to make sure that everyone has equal access to that vaccine, and especially populations that were hardest hit by the virus in the first place. And we are seeing both here in Massachusetts, we mirror the same thing in Gloucester, a couple of ones I'd like to point out. And one is by sex. So we have females getting vaccinated at quite a bit higher percentage or rate than males. So we want to watch that and try to figure out ways that we can tailor our message or our information to help men feel more comfortable with the vaccine, to help ensure they have access at equal rates. And the other thing is minority populations. We're seeing, particularly with our Hispanic populations, the rates of vaccination are in the 40s, whereas for white residents, it's in the 60s, 64%. So that's a big discrepancy in terms of the percentage of the populations. We want to understand that. We want to focus on it. We are translating materials. We are working really closely with different communities on Cape Ann to make sure that messages get out there and information is provided, and we address that. So that's kind of the picture on vaccines. I think it's a really good picture right now. I think we're in really good shape. So looking ahead, I think we can imagine that the mass vaccination sites will start to downsize and close. We've already seen that. And again, there'll be a shift to smaller, local, different ways in which the vaccine is available. Your doctor's office, your CVS, subways in New York City. I mean, we've heard all kinds of creative things. So that's great. Making it available locally is really important. We also don't know about boosters and annual vaccines. We expect still that a booster will be needed. And I know Moderna is working on the development of one, and they're coming along well with that, and hope by fall that they will have something approved. So they're kind of ready to start taking their boosters to the next approval level in the process. But we do not have any definitives on boosters yet, when they'll be needed, how often, what types. If you got the J&J vaccine, can you get a Moderna booster? I mean, there's a lot of questions here, and our team is watching the data, watching the information, and we will hopefully be in a position to offer boosters and additional annual vaccines as soon as they're available. In terms of new variants of concern, I said we're not seeing any right now, or it's below the level of detection in our wastewater, so that's great. In the state, the same thing, the numbers are very low right now. But I have to caution, we live in a very global world. This was a global pandemic. We're seeing lots of variants throughout the world that are changing and will continue to change. We expect that the virus will continue to do this. We don't know how well our current vaccines will hold up against variants. We know as of now, the vaccines are providing some protection for most of the variants. So you may still get COVID, but you won't get as sick from it. But we don't know if that will change given the new variants that we may see. And on a quick search today, it looks about like approximately 20% of the world is vaccinated. So that's not a lot of people in our worldwide profile. And again, wealthier nations are vaccinated at higher rates than poorer nations. So there's definitely this inequity piece for all public health issues. This isn't new to us, that has kind of mirrored itself in COVID. So it's important that the worldwide picture improves or we're not protected, because people are going to Europe this summer and they're traveling and things are opening up. So on to the changes from the state. On May 18th, the governor lifted the mask mandate for K through 12 students outside and athletes, spectators, coaches, that kind of thing, camps. This is great. This is, I think, really important. There's very little transmission that was ever documented outside, especially in children. And these kids have done a great job going along with masks and hanging in there. And now they can outdoors, regardless of their ability to maintain social distance. They may be free to not wear their mask while they're outside. So that happened pretty quickly last week. On May 29th, the governor will lift all COVID restrictions. So except for a few, which I'll go over the couple of exceptions. But basically, we can kind of think about things pre-COVID. If you were a restaurant opening before COVID, you can go back to looking like that. All of the spacing requirements, all of the face covering, logs, log books, all of those recoverings in those specific checklists are no longer going to be applicable after the 29th. So it's business as usual, back to how you operated prior. Except again, I'm going to go through the few exceptions for that, and then the few choices that go with that. So the exceptions to the face covering band being removed, so where you still need to wear a face covering, is public and private transportation. That includes Uber, Lyft, buses, trains. It also includes stations or places in which you transport hubs, they call them, or something to that effect. A bus stop, a train station, you're still required to have your face covering on in those places, airports. Inside K through 12 public schools or other accredited schools and programs with the state, inside childcare programs, inside healthcare facilities and providers' offices. So this is most healthcare providers, including PTs, OTs, ophthalmologists, really most healthcare providers and settings. Congregate care, as defined by, during COVID, shared communal bathrooms, kitchens, that sort of thing. So people living in congregate care settings are still considered to be at higher risk and therefore are still required to wear face coverings inside. And day services and programs for healthcare or rehab are also required. But things like your senior center, your councils on aging, your libraries, they are not required to have masks, have people wear masks, unless they are offering one of these programs or a day program. So those are the exceptions. As of the 29th, the face covering order number 67 will be replaced with an advisory. So, and the advisory is based on the CDC's recommendations that if you are not fully vaccinated, for your own safety, you should continue to wear a mask when you are within 6 feet or within, when you're inside. So we're encouraging businesses. We're part of a local campaign, a regional campaign that's has some slogans and signs saying masked or vaxxed. So it's not something like, again, with all things with COVID, we're not anticipating policing, asking for cards, that kind of thing would be impossible. And just to remind people, there are still the same exceptions there always have been to the mask order. If you're under 5 years of age, or if you have a medical reason, of which there are 4, that you can't wear a mask, then you don't have to, and you don't have to provide proof. So I know a lot of businesses are thinking about this and kind of struggling with it. Our recommendation is to put a sign up that, you know, we prefer masks or masks. If you're not fully vaccinated, the advisory is to continue wearing a mask, a face covering. Business and organizations, though, can set their own policies, and I know all kinds of agencies all over are trying to figure out what their policies will be around number of staff, working at home, away, whether they come back to the full capacity of your office, your restaurant, your business. face coverings, all those things. So that is their right to set new policies as they see fit. And I think, and the last thing is that on June 15th, the COVID state of emergency, the governor's emergency orders will be lifted completely. And he is currently, just got a notice that the governor's office has filed for some emergency legislative fixes to the couple of things that would really be left hanging. One is the quorum rule around an open meeting law. So he's trying to modify the legislation quickly so that after June 16th, you can have an in-person meeting with a virtual component, and that can count towards a quorum. And the other big thing that's sort of needing a legislative fix is the licensing, the extension of special permits for communities to allow outdoor dining and liquor licenses through whenever. So those are the big changes really quickly. What is there anything I can further explain or answer for you guys?
Karin, can you just go over all that one more time?
Oh, I will tonight at City Council. You'll hear the whole thing all again.
Well, I have one question. We had discussed in advance, and I think it's a really great point. So if you could touch on it again, transportation for people who may not be able to get to a vaccine. I think there's a lot of it around, right? Do you want to talk about that?
Yeah. So I think that the CADA still provides free rides for anyone who needs transportation to a vaccine site. Certainly Senior Care have been great partners with us in providing rides. Senior Care has an army of volunteers that offers rides all of the time, and they've been a huge help in getting people rides to vaccine testing or to vaccination clinics. But again, hopefully the local, having the supply here locally and available ongoing will help that burden as well. I think you mentioned that Lyft is offering a free ride. Some of these initiatives may be done statewide or done by businesses, but certainly there are lots of options if someone does need a ride to a vaccine site.
Great. And I have one more question. Are you, as the Director of Public Health, seeing any of the any patients with long-term effects from COVID?
So we don't see patients here in the, I mean, other than the patients that we contact traced, and once they've been cleared through our protocol, we don't tend to follow, we don't still follow up with them. However, if we do become aware of people still having problems, or we refer them back to their primary care provider. And we've also recently learned about the Addison Gilbert has a long haul clinic that's run through the infectious disease unit. And we've encouraged, our nurses are letting our patients know about that we are involved with as we're tracing. And we've also tried to make sure that our local providers and GPs know about this clinic. So we're really thrilled that there's someone here in Gloucester on Cape Ann that's beginning to follow these patients and offer support to them and keeping up with all of the latest research, because it definitely is a real thing. There are these long haul patients that have symptoms and side effects for a very long time. And there's just, it's also new. We don't understand. So really happy that AGH is offering that program.
That's great.
It's amazing now that we actually are turning the corner, it seems, finally, after months and months of talking about when are we going to see more light than tunnel.
I know. Yep.
We appreciate all your work, Karin. Like, this is phenomenal, and we can't believe how you manage this day to day, but you have, and the whole department. So cheers to all of you for your work.
Standing ovation. You have, from the start, you have kept this show going too.
Well, happy to talk with you guys and your great questions. And yeah, the team here has done a phenomenal job, and our COVID task force that's met with our city partners, city departments, administration, and all the agencies that stepped up in those early weeks and continued. We just met again last week. We sort of reconvened the whole group to say, hey, here's what's going on, and can you get the word out? So it's a fantastic community with lots of great partners. And we thank you guys for your help too.
Oh, well, it was a pleasure, and we thank you for your access to all your information. It was really served the community well, I think.
Yeah.
Great.
Let's do this in person someday, Karin.
Yeah.
I'd love that.
Okay,
Yeah.
thanks again for your time, and we will chat with you soon.
All righty. Take care, guys. Bye-bye.